Hey guys, I'm going to show you the 3 best ulnar nerve exercises to improve sliding in locations of ulnar nerve entrapment. This video is intended for a lot of the patients that we see in our office with ulnar nerve entrapment. We're going to show step by step how to do the ulnar nerve slide through different regions of the shoulder, the elbow, and the wrist. However, for full transparency, if you're trying this without advice from us to do so, just know that some of these stretches can make symptoms worse, and they're only implemented in certain types of scenarios. If you'd like one-on-one guidance about if you should be doing these exercises, you can reach out to us. We have virtual and in-person options. See the link in the description below. Make sure to bookmark this video and come back to it, subscribe, and like the channel. And we're going to get right into the exercises now. All right, Sarah's here is going to help us out with locations of the ulnar nerve slide that we're going to do. So we're going to do the wrist here, which is the tunnel of Guyon or Guyon. There's the cubital tunnel here, which many people believe that they have, but not all of them do. And also there's slide through the shoulder here as well. It's important to note also that there can be nerve root entrapment at the neck. We won't be covering that today, but we're going to cover the slide. And usually this comes after we clear out the congestion of the nerve, the swelling of the nerve, and we're just endorsing more slide. Now, the first one we're going to do is at the shoulder here. It's pretty simple. Sarah, let's use your left hand, and I'll just kind of stay out of the way here. Okay. So it's important to realize that you should not be moving the area you're sliding through, i.e. Sarah's shoulder should not be moving at all. Okay, you want to show us the one?
Yes. This one.
There we go. There we go. Yes, think about it, huh? So we talked about it before we did this today, and this is actually important to note that it's very hard because these movements are awkward. This is why we don't always send people home with this, because sometimes they do the opposite. And in this case, if she were going to do you know the owl stretch that people do?
Yes.
Can you show us the owl stretch? This is technically an ulnar nerve tensioner, which will hurt a lot of people in the short term, not maim them, but actually create symptoms. And so we want to create slide through, which all it requires is elbow bend and neck movement. So she's moving the neck to pull it, she's moving the elbow to pull it, but she's slackening the other side. Okay? She's just going to do 10 reps. It's probably going to feel like you're not doing anything, right, Sarah?
Right.
Perfect. These should not feel stretchy. If you feel stretchy or you feel symptoms, this is not for you. Okay?
And there's no wrist movement, right?
There's no wrist movement on this one. There'll be wrist movement in the other ones. Okay? Now the next one we're going to do is we're doing it with the elbow. All right, this one's the hardest one of all of them. And so, Sarah, why don't you turn that way a little bit so everyone can kind of see your arm here. All right, so we talked about if there's a little koi fish in the pond, can you slowly sink your hand down to sink under the soft belly of the koi fish here? Okay, right? And so in this case, she's pulling the ulnar nerve up and she's allowing slack. And then let's just do the opposite. Good, and go again. How awkward does this feel for you?
Pretty strange at first.
Now, yeah, now she's moving the rest of her, and that's okay at the moment. Normally when we show these at least bare bones, like the simple foundational ones, like as long as it doesn't hurt the person, it's okay. But ideally, if we want to get the best results out of the sliding exercises, you want to have it more refined. And so in this case, as long as she's not moving the elbow, I'm okay with a little bit of slop elsewhere for now. Do you feel any problems with this, Sarah?
Nope, not at all.
There you go. It's a good scenario. She doesn't feel like she's really doing anything other than this weird exercise that someone gave her to do. Okay? Let's go on to the wrist now.
Okay.
She had a good analogy with this one. What was your analogy?
Touch your shoulder and then become Spider-Man.
Become Spider-Man. I like that. So how this is going to work then is that she needs to act like her wrist is duct taped up though. Okay? And so we're going here, and then what was your Spider-Man? Oh, you're doing a little bit of wrist though. So it's mainly going to be here, okay? Okay. In this case, the ulnar nerve is pulling to the elbow here, so it's sliding this way. In this way, it's sliding this way. And you have to give slack to pull it, all right? Now, if you guys are looking for people to actually work with for ulnar nerve sliding or median nerve sliding, I would suggest somebody who's done the work of Michael Shacklock, Neurodynamics. You can call and ask the people if they've been to Shacklock's course, It's very particular, and the nuances of nerve sliding are pretty important. And so we have done them here, and his work is pretty foundational if you're going to resolve things like ulnar nerve problems that go out into the hand that are not like a diabetic neuropathy. So if you guys are looking for help with ulnar nerve conditions and looking to improve slide, reduce the amount of numbness that you have, we can work with you virtually or in person. In person is always best for this, so we can do a big workup to figure out if there's any motor deficiencies, if there's any sensation deficiencies, and basically rule out a lot of things. The tests that we can do, the exams that we do, are pretty particular. They can be, we can do some of them on video, but it's better if you actually come in person. Typically, people don't need other types of images or advanced studies like NCVs and EMGs and MRIs and X-rays to start care with this. So if you guys are looking for guidance, please reach out to us. Our contact is below. Lastly, before we go, I want to highlight that we do have a book about the ulnar nerve. It's an ebook, and it helps people find the right route to take with their problem. Not everybody is aware of what to do, who to talk to, the signs and symptoms of ulnar nerve, as well as some methodologies that can help. And so we put together a resource that you guys can get access to on our website. And it may not be the right thing for you to do, but hopefully it gets you on the right path of what to do. And so take that information, absorb it, and go to your healthcare provider and talk about your problem, and hopefully you guys can come to a conclusion about what to do.